This is my video on the muscles and their actions. So right here we have your mandible, which is bone, and then we have your digastric muscles right there, which elevate the hyoid and depress the mandible. Beneath that we have the mylohyoid, which elevates the hyoid and is tongue-based. And then underneath that we have your extrajugular jugular vein. And then right here we have your masseter, which elevates the mandible and is a muscle of mastication, which is for chewing. And then we have your mylohyoid right here, which depresses the hyoid and the larynx. And then we have your sternomastoid right here, which rotates the head. And then we have your clavotrapezius right here, which draws the scapula craniodorsally. And then we have your pecto antebrachialis, which adducts the forelimb. And then we have your pectoralis major right here, which flexes, adducts, and medially rotates the arm. Just beneath there we have your pectoralis minor, which elevates the rib cage and protracts and depresses the scapula. Just beneath there we have your xiphi humerellus, which adducts the forelimb. And then we have right here your serratus ventralis, which protracts and rotates the scapula. And then we have your latissimus dorsi right here, which is also known as your handcuff muscle, and that extends, medially rotates the arm and adducts. And then we have right here is your rectus abdominis, that flexes the trunk and compresses the viscera. And then just beneath there we have your transverse abdominis, which compresses abdominal viscera. Right here we have your external oblique, which flexes, rotates, lateral flex of the trunk, and compresses viscera. And then just inside there we have the internal oblique, which performs the same action, so it flexes, rotates, lateral flex of the trunk, and compresses the viscera. And then right here we have your scalenes, which rotate and flex the neck, and they also elevate ribs 1 and 2. And then we have your serratus ventralis again. And then we have your subscapularis right there, which for the humerus it's a medial rotator, and it also holds the humerus in the glenoid cavity. And then we have your biceps brachii, which flexes and supinates the forearm. And we have your epitrochleus, which extends the forearm. And then we have your pronator teres right there, which is the pronation of the forearm, and it flexes the elbow. And then we have your flexor carpi radialis, which flexes and abducts the hand. And then we have your palmaris longus, which is a wrist flexor. And then we have your acromiotrapezius right here, which draws the scapula dorsally. And then we have your spinotrapezius, which performs the same action, and so it draws the scapula dorsally. And then we have your acromiodeltoid, which flexes and rotates the humerus. And then we have your levator scapula ventralis, which draws the scapula cranially. And then right here we have your spinodeltoid, which does the same thing as your acromiodeltoid, so it flexes and rotates the humerus. Right here we have your triceps brachii, so you have your long head and your lateral head, and the triceps brachii extends the forearm. And then right here you have your brachialis and then your brachioradialis, and they both flex the forearm. And then you have your extensor carpi radialis longus, which extends and abducts the hand at the wrist joints. And then you have your extensor digitorum communis, and then your extensor digitorum lateralis, and they both extend the phalanges, the wrist, and the elbow. And then you have your extensor right here, your extensor carpi ulnaris, which extends and adducts the hand at wrist joints. You have your rhomboid capitis right here, and that draws the scapula cranially. And then you have your splenius, which extends and hyperextends the head bilaterally, and also flexes and rotates the head unilaterally. And then you have your supraspinatus, which is the abduction of the humerus. And then you have your rhomboideus, which retracts and elevates the scapula. Excuse me. And then down here you have your sartorius, which flexes the knee, flexes the thigh, and laterally rotates the leg or the thigh. And then you have your gluteus medius, which abducts and medially rotates the thigh. And then you have your tensor fascia latae, which abducts, medially rotates, and flexes. And then you have your gluteus maximus, which extends the hip and laterally rotates the thigh. And then you have your caudofemoralis right there, which flexes the tail laterally. And then right here you have your hamstring. So you have your biceps femoris, which extends the thigh, flexes the knee, and laterally rotates the leg. And then you have your semimembranosus, which extends the thigh, flexes the knee, and medially rotates the leg. And then you have your semitendinosus, which extends the thigh, flexes the knee, and medially rotates the leg. And then right here is your sciatic nerve, and there's your common fibular nerve, and there's your tibular nerve. Right here you have your gastrocnemius, which is for plantar flexion, knee flexion, and foot inversion. And then right in front of there you have your soleus, which is for plantar flexion. And then you have your tibialis anterior, which is for dorsiflexion. And then right here you have your fibrialis pinaris longus, which is to elevate the foot and plantar flexes. And then right here you have your gracilis, which is for it adducts the thigh and flexes and medially rotates the leg. And then you have your iliopsis right there, which flexes the hip. And then you have your vastus lateralis right there, which extends the knee. And then you have your rectus femoris right there, which extends the knee and flexes the thigh and extends the knee and flexes the thigh. And then you have your vastus medius, which extends the knee. And then you have your pectineus right there, which flexes, adducts, and medially rotates the thigh. And then down here you have your plantaris, which is for plantar flexion and knee flexion. And that is the overview of the muscles on the cat.